Today I will demonstrate the application and removal of dental dam from tooth number 24 to 13. Okay, so firstly we want to involve the client and ensure client comfort by asking the client if they're familiar with dental dam, if they've had it before. If they have had it before, a quick explanation will do of a reminder. If they have not had it before, you definitely want to provide the rationale for using the dental dam, that it keeps the area dry and it prevents debris from falling down their throat perhaps, and ensure client comfort by telling your patient, don't worry, you'll be able to breathe through your nose and still swallow little bits at a time, but you'll be able to swallow as normally. If you have any trouble at all, just put up your hand and we'll try to facilitate you. You must receive client consent before applying, so you always want to make sure that they agree and they tell you that it's okay to proceed. Once you receive client consent, maintain your principles of ergonomics by positioning yourself, your client, and the equipment in the proper positioning to facilitate your application and removal. Remember to practice your proper instrumentation using a fulcrum throughout your appointment, and your mirror for indirect vision and retraction where applicable. When you're ready to begin, sitting in the operator position, you want to examine your treatment area. Okay, this will ensure that you're familiar with dental dam on, and if there's any misaligned teeth, any teeth that are missing, and any tight contacts. You may want to place Vaseline on the client's lips at this point if they look dry, or you can ask the client if that's what they would like, and it just provides a little bit of extra client comfort for your client. Okay, so you have examined the treatment area. You also have the options, perhaps there's crowns or bridges or restorative treatment that you want to just become a little bit more familiar with. It's always a good idea to floss that area prior. So we saw over here it's a little bit tighter, good to know, between the and nice loose contacts throughout the rest of your area. So good to know that you have one tight area that you may just keep in the back of your mind for future reference. Okay. So we want to proceed by punching the dental dam, or with punching the dental dam. This is on the maxillary arch, so we're going to be 2 centimeters from the edge of the dental dam is where your first landmark is going to be. Also, if you want a quick orientation, if you use half a thumb length, your end of your thumb up to your first knuckle, that's usually about 2 centimeters. Also, you can use your dental dam punch as a guide too. Okay, so your first punch is basically the length of your dental dam punch from the opening to the key punch pad. Okay, so the correct number of holes and correct holes in position, it will look something like this. Okay, so we're doing 2-4 to 1-3. Okay, so if we use this dental dam as a reference, I'll review the guide here. Okay, so here's I would punch them symmetrically. Okay, and what I mean by that is when you do the the 2 centrals together, there we go, it's more symmetrical. So I started with the 2-1, I'm going to punch the 1-1. Okay, and I go to the 2-2 and I'll punch the 1-2 across. The 2-3 and 3-3, and then my key punch hole is back a bit further, and that's the 2-4. Okay, and just as a reminder, your key punch pad, the centrals and laterals, you'll use hole number 2. For the canines, you will use hole number 3. And then for the key punch hole, or tooth number 2-4, you will skip and use the most posterior hole on your punch pad. In this case, it's the hole number 5. Please note the extra distance I provided between the last punch and the key punch hole as well. Okay, we want to ensure gingival full gingival coverage, and that's one way to do that. Okay, the dental dam is now punched. I'm going to go ahead. Okay, for a premolar isolation, I like using the Ivory 00 is my preference. There's other ones out on the market that are just as good, I'm sure. Okay, so once I've selected my clamp, I'm going to attach a piece of safety floss onto the bow of the clamp to ensure client safety. In case it pops off during application, you will have a piece of floss to hold on to prevent aspiration of the clamp. Okay, here's the clamp. The first thing I'm going to do is get a piece of floss and double it up. Okay, once I've doubled it, I will lay over my tray troll, of course I would work on, but for sake of video I'm doing it in front of the screen. Okay, so the floss goes behind the bowl. Okay, so right, get your fingers kind of through your floss like this. Okay, underneath. There we go. Retrieve the tail end. Of the floss. And again, I actually feel uncomfortable with it. I'm going to move away from it and go over my tray troll because that's my comfort zone. Okay, and I have the knot. I'm just going to pull it nice and tight, and it's secure now around the bow. Okay. Okay, so at this point you want to ensure effectiveness of your local anesthesia. Okay, we're going to say that the 2-1 is the tooth we're going to be working on today. So I'm just retracting the lip with my fingers, fulcruming, and using a fulcrum with the Explorer and tap lightly on the tissue. Does that feel all right? If their client is comfortable, then you have attained effective local anesthesia. Okay, so you may then begin to place the dental dam. So you want to begin by getting your forceps, dental dam forceps. Remember, you have beaks on the end right here. Okay, you're going to have the safety floss on at this point. Okay. Place the beaks into the holes of your clamp, orientate it for a mandibular arch, lock it in place. Once it's locked, turn your forceps over so that you're ready for a mandibular section. Now I notice this floss, now that I'm orientated, is going to be on the lingual if I place it up here. So I'm going to switch that over to the buccal. There we go. Okay, once you have that, you wrap the floss around your pinky finger of the hand holding your forceps. Okay, again, that's for security if the clamp pops off the tooth while you're in your hand. Okay, using indirect vision, you will introduce your mirror. Okay, I like retracting the cheek with my finger to facilitate my vision. You don't need to do that. You can just fulcrum on the cheek if that's okay with you. If that works for you, I mean. Okay. Just trying to get the tooth in the mirror for all my viewers. Okay. Kind of see what I'm doing. What I'm doing is placing the clamp. If I do, there we go. Good job. Good job. So I'm having the clamp stretched quite a ways around the tooth. Go over the entire surface. Put pressure, not pressure, put the prongs towards the lingual aspect of the tooth, slide the clamp over that height contour until you feel resistance, and then slowly release on and slide down the buccal and do the same. Okay, you should feel resistance. They're anesthetizing in this area, so you don't need to worry too much. You want to ensure that the tissue is not being impinged though. So I release my forceps. I'm going to just have this floss out the side so I know where it is at all times. Okay, I'm putting my forceps down, using indirect vision to check clamp placement. What I'm checking is that the prongs are not impinging the tissue and they look like they're fine. They're over the height of contour and just sitting where the sulcus, near the sulcus. Okay, before proceeding, I want to ensure stability of the clamp. So I'm going to rock it back and forth, fairly stable, check your bow, and it's not moving. So that's a stable clamp, and that's what you want. If it is unstable and moving around on you, you would want to either try a different clamp. You may want to get a new clamp because sometimes the clamps get stretched from using them a few times over. Okay, you are ready to apply the actual dental dam now. So you are going to begin by passing the floss through the key punch hole of the dam. Okay, and how you do this is you line up your dental dam, orientate yourself. There's the key punch hole. You're going to place your cotton pliers through that hole, flip back the dental dam over, retrieve the floss that's attached to the clamp with your cotton pliers. Okay, flip the dam back over. This will come through for you, like so. Okay, it's through the hole. Okay, you now need to place the dam around the bow and jaws of your clamp. So again, you need to get your fingers, stretch that key punch hole across, open it up a little bit. Using direct vision, you need to get over that bow, and I would just continue with the jaws. As best as you can. It's at this point where I like to put the frame on. It's over the bow and most of the jaws, so get your four corners of the frame attached to your dental dam. If I just back this up a bit, you might be able to see that. Okay. I'm going to wrap the floss around the frame. Sorry you can't see that part in this video, but if you refer to the other videos of the maxillary posts, posterior area and mandibular posterior area, you will be able to see that. Okay. Okay, so you are now exposed to that area. Okay, so we're going to then isolate the remainder of the teeth, okay, by stretching the dam over each tooth, the mesial and distal areas. So the idea of this is just to get the dam through your contacts, okay? And I want to line it up appropriately, make sure I have the teeth orientated with the holes. So 3, 2, 1, and 1, 2, and 3. Yes, go have them all, so that's good. I'm going to begin flossing. Like I said, the idea here is just to get the dam through the contacts so that it's staying on for you. And I'm going through the embrasure space. And then the 1, 3. This mannequin has open contacts right there, so I may need to place a couple ligatures. We'll see how that turns out. That might be okay. Okay, so it's pretty much through all the contacts. This isolation is from tooth number 2, 4 to 1, 3. 2-4 being the... Do you notice how the 2-5 is exposed? That does happen for isolation, okay? Or if you have another molar behind your anchor tooth. This happens quite regularly. So what you do to fix that is we need to cover that 2-5 up with the dental dam. Okay, so the best way to do that I know of is to just retract your dental dam with your thumb and finger, and you see how you just opened up a space right back there where you can get your flat plastic instrument underneath that open area. Okay, so when you do it, try not to poke the dental dam. It will cause a tear. If you just slide the the flat plastic instrument underneath the dental dam up to the handle and just guide it up and around this tooth. Sorry, you can't see that very well. See how I'm just stretching it and kind of pulling it forward a little bit. Okay, and it covered it up. And there you go. Okay, one more time perhaps. Going in, pulling it up, and I'm pulling it forward with my flat plastic, and I don't want to have this poking through like so. You want to have it the opposite way where you're using basically the handle to lift it. Okay, good. And that's how you get that around the 2-5. Okay, so back to inversion. I'm going to focus on the mesial and distal inversion. So how I do that is you, with your floss again, once you're through the contacts, you will invert mesially and distally. So you're going to floss again. Okay, thinking of inverting on the mesial and distal. So this will be the 2-4 mesial. I'm inverting, going up and down using a C shape. Come up until the contacts, go down the distal portion of the 2-3. And I'm inverting the distal of the 2-3 and out the embrasure space. Okay, same thing as I continue on. So distal of the 2-2, mesial of the 2-3, and out the embrasure space. Continuing on in that fashion throughout your exposed area. Okay, ensuring many times we're looking at the facial and not thinking about the lingual, so make sure to make a nice C shape so that it goes down on both sides. Keeping the client comfort in mind, we don't want to be pushing really hard into the tissue. We want to just be nicely, gently, and in the sulcus and out the embrasure space. This is my open contact area. So did you see how that just came back up? I didn't go without the embrasure space, so I had it inverted and it just relapse to where I had it before. Okay, and then the last one. I always like to check the lingual aspects, and because like I said it's tricky, we kind of can see the facial but not the lingual. And what I saw with this is that there's still quite a bit of dental dam rising up on the back of those teeth. So I'm going to do it again, concentrating more on the lingual aspect. Okay, so C-shape, definitely more on the lingual is required. Okay, that is better. Okay, for a ligature in this case, it is very difficult to use a floss ligature, central or lateral tooth. In this case, we're isolating 2-4 to 1-3. You can do it, it's difficult, so I'm going to show you some other alternatives to dental dam isolation ligatures. So the first other option is using a wedge. Okay, so you could use a wedge and simply place it on the distal of the 1-3. Okay, that would secure and hold your dental dam in place on the opposite end that you're working on. That's perfectly fine. Okay, another option is using a corner of your dental dam. Okay, So I'm just going to snip. Can't see this, unfortunately. I'm sorry about that, but I just snipped a corner of the existing dental dam that's on this client right now. Okay, just a little triangle, doesn't have to be pretty. It's a little triangle, fold it in half, and just give it a little twist. Okay, so it looks something like that. Okay, and you just simply go back and forth, similar to how you would floss. It's more, but you'll feel it go through the contact, and that's it. So of course we won't want to leave that extra piece of dental dam under on the lingual aspect. So you would just trim it with your scissors. So just stretch it. It's attached nicely on the contact. The facial, you want to leave a little tag like that out so that you can hold on to it and remove it if required, which I'm going to do right now. So again, you can use the cotton pliers, or I think it's just as easy to get a hold of it with your fingers and pull it out. Okay. The last type of ligature that I love using is a stabilizing cord. Okay. So that's what a stabilizing cord is. It's very stretchy, but very similar to a piece of floss, elasticized floss, basically. Okay. And you would insert it the same way as a piece of floss. Okay. So you're back and forth until you're through that contact, similar to how you'd use the corner of the dental dam. Again, a little bit of excess there that we probably don't want. So you don't really want to, once this is placed, you don't want to drag this. You know, if you want to just drag it towards the facial to get out the lingual, not a good idea. That will injure your client. So you could get a cotton pliers, hold on to the lingual aspect, trim it. This can be quite tight to your tooth. This is not the tooth you're working on typically, so it's okay to have a little extra tag out the lingual. And then the facial might be okay as is. It's a little long if you want to trim it, but please to hold on to for removal later. And that's the ligature I'm going to leave in. Okay, so the ligature is placed. I'm going to go back to inversion. I know I've done the mesial and distal aspects. I'm going to concentrate on the facial and lingual, and these all look inverted. If I need to, if I feel there's one or two areas that did not invert with flossing, I will use my air first. So you're going to retract. So let me try to get you to see. Okay, retract an area, blow basically in the sulcus area, going around your tip, and slowly release your dental dam, and it inverts nicely. The other way of doing it, if that is not successful, we will then introduce the flat plastic instrument. Okay. Technique is the same for retraction. We would retract it, try to slip your flat plastic instrument on the mesial or distal aspects, release your dental dam, and roll the flat plastic while you maintain a fulcrum from mesial to distal. And that will give you the inversion of your dental dam where you want a rolled under collar, basically. Okay. And to conclude the application, we want to stretch and secure the attached dental dam onto the frame. So originally I just put it on the four corners. I'm going to stretch. Again, you can't see this, my apologies, but it is on the other videos. And that concludes the application. Okay. Once the restorative treatment is completed and it's time for removal, we want to ensure that there's no debris left on the dental dam prior to removal. So we most often would provide a rinse with the high volume evacuator in the area that we worked on and just clean up the dental dam in that respect. So with the air water syringe in your dominant hand, HVE in your non-dominant hand, you're going to place it, make that little trough. Okay, allow the water to go into that trough while you rinse. Okay, so it's just a simple facial, lingual. You may want to clean up the dental dam a little bit. It doesn't have to be an extension, a long rinse, just a quick rinse is most likely what you will need. You are ready to remove the dental dam now. Okay, so you will remove your ligature first. Okay, so the stabilizing cord that you used, you may use your, I'm fulcruming and removing it. If you want to, if you can hold on to it with your fingers, you may just simply remove it with your fingers as well. Okay. Cutting the septa, scissors positioned horizontally while we stretch away the septi, each septi. So one hand, my index finger again on the lingual aspect of the dam, if you want to think about it that way, and my thumb on the facial. So one has already popped off, so that's okay. Okay, again, you're stretching each septa. Make sure you have the scissors completely around each septi prior to cutting, and it's ready to cut. Okay, you may need to work with the lip a little bit to try to get under there properly. Okay, stretch, cut. Stretch. When you can see the beaks of your scissors, you know that you're not cutting the lip then. Right, so that's another important aspect. Not only is it a nice clean cut for your septi, but you want to ensure that you're not injuring your client with your scissors. And I maintain the horizontal position with my scissors throughout. And with that last one, we want to ensure all septi are cut. So, and I don't feel I can get to it with the scissors. I'm going to go to the scaler. I'm going to get him. Again, retract. Okay, you want to make sure your fingers are clear out of the way though. You don't want to injure yourself either. Get your scaler with the tip of the scaler pointed towards the occlusal. Okay, I have the scaler around the entire septa. Strong fulcrum with the instrument holding the scaler, and pull up and you cut your septa. Okay, loosen your septa from the lingual aspect. Everything's nice and loose. We don't want any reason for pieces remaining behind. Okay. At this point, you would use your dental dam forceps using indirect vision to find the holes. Place the beaks into the holes of your clamp. You need indirect vision for the lingual. You may be able to use direct vision for the buccal aspect. And again, my apologies. There you can see a little bit better. Squeeze your forceps to open up the clamp. You may remove it all as a unit, or you may drop the clamp at this point because it's attached to the frame and remove it as a unit. Okay. Tend to your client first and foremost by providing a full mouth rinse using the saliva ejector. Okay. Again, an air water syringe in your dominant hand, saliva ejector in your non-dominant hand, and from one side over to the other, doing the buccal surface and then over to the lingual. Okay, and then even onto the mandibular, even when you're working in that area. And sometimes you might want to use water and air just to freshen up the entire area. Good. Now you know your client is comfortable. Ask him, can you please just close? You may close just gently, please. Don't bite too hard yet. And the last portion of the removal is to ensure that your cut is a nice straight cut. Okay, and you want to check for missing pieces. So on my dental dam, I'm checking